You're listening to What the Gut, a functional medicine and holistic health podcast for busy women who are ready to take charge of their health without the overwhelm. I'm Allison, your host, a double board certified family nurse practitioner specializing in functional medicine, here to help you decode the gut hormone connection and finally get the answers that you've been searching for. In this space, we're cutting through the confusion and diving deep into holistic wellness, because feeling your best is not just about another diet or quick fix. It's about understanding your body, healing from the inside out, and making sustainable changes that fit into your real, busy life. From gut health to energy struggles, hormonal imbalances to sustainable weight loss, I'm bringing you practical strategies, expert insight, and real talk that will help you thrive, not just survive. So if you're ready to finally feel good in your body again, hit that subscribe button and let's do this together. Quick reminder, this podcast is for educational and empowering purposes only, and it is not intended as medical advice. Be sure to consult with your personal healthcare provider for personal recommendations. Welcome to What the Gut, where we take control of our health one episode at a time. Welcome back to What the Gut. Today, I have the pleasure of speaking with a really remarkable guest, a physician and nephrologist who's dedicated her life to bridging the gap between conventional and holistic medicine. Born in Hungary, she's been living in Nepal for the past 19 years with her husband, who is also a Nepalese doctor, and their 3 children. Together, they have founded the Jeewasha Foundation, a nonprofit organization providing vital support to kidney disease patients facing severe financial burdens in Nepal. Her passion for health really began at the age of 10, driven by a deep curiosity about medicine and healing. And through her journey, she discovered functional medicine, which has become the cornerstone of her approach to addressing chronic disease issues like gut health, insulin resistance, autoimmune, and thyroid conditions. Now she runs a successful online course that empowers people to take charge of their health by making lifestyle changes that are practical, sustainable, and rooted in holistic understanding of the human body. Dr. Klara Paudel, welcome to the podcast.
Thank you for your invitation.
Really excited to have you here today. And also, I'm pretty sure that I butchered the name of your foundation. Did I say that right?
Yeah,
Jeewasha Foundation? Okay,
Jeewasha.
good. I'm from Mississippi and pronunciation's just a little different here. I love everything that you've done. Going from a traditional background to incorporating functional medicine is always so interesting to me. And now I'm curious, we see such an epidemic of chronic disease in our days. I know, especially just where I am in Mississippi. What do you think is the biggest reason behind that?
I think chronic diseases were always there, but now the environment, the toxins, and the food supply, the food has much less minerals, vitamins than before.
Yeah,
We need adequate nutrients, and we do not need all those toxins. So according to my theory, the main reason for the diseases is all the toxins
yeah,
and deficiencies. And because of the deficiencies, we are not able to excrete them. I have seen another significant rise in conditions in chronic diseases in the last 15 years, probably 15 to 20 years. And I would say that 20 years ago, most people didn't have a mobile phone. But now there is everywhere we have the mobile networks, and that is also a very big contributor for the
yeah.
health line.
Yeah, and a lot of people don't just have one chronic disease, they have multiple. And I know especially with kidney issues, like the heart is tied into that. And some people with kidney disease also have diabetes as well. It's just this cycle, especially autoimmune and thyroid disease, that is so much more common these days. Do you think that more people have thyroid disease because we're just noticing it more and testing them more, or we're more aware of it? Or do you really think that more people actually have that?
It's really difficult to say because I know it from my own experience. When I was a medical student 25 years ago, it was a rare thing to see a patient with hypothyroidism. So that time we could only notice the ones who were they had overtly symptomatic. And if you would say 20 years ago, if you would say Hashimoto thyroiditis, most people don't know what is that because they
Right.
have not diagnosed it much. But as the awareness was also growing, like we are also more aware that thyroid disease is common. So now we are also testing it routinely for everybody. But 20 years ago, it was not a routine test. It was
Yeah.
just only the symptoms we were testing. So
Right.
we are testing more. That is definitely the case. But if we look at other diseases also, just like diabetes and autoimmune conditions, they all are growing.
Right. Yeah. That's always like tricky to me. I know that we are searching for those answers. Like we're always searching for that root cause. So we are taking a deeper dive. So we are discovering more, but it's a hard situation. But if we never discovered this, would it be a problem? Most likely, yes. Most likely, yes. But it's very interesting to think about for sure. Now, does your husband do the same kind of work that you do?
We both are internists, so we see all kinds of patients with the diabetes, hypertension,
Yeah.
gut issues, respiratory issues. We see all these. We work similar, but
Yeah.
I work more with the kidney disease. I run the dialysis unit and take care of those people on the dialysis and the kidney disease patient.
I've been in Mississippi my whole life, and we are one of the most unhealthy, poorest states in the nation. And I worked at the hospital and in clinic for a long time. And so many people have chronic kidney disease and diabetes, and it seems like there's so many dialysis centers like on every corner. And it's just to me, it's we live in such a small world in our head and don't realize that people in other countries like suffer from these same chronic conditions sometimes. It's just very interesting to think about.
Yeah, so basically in Nepal, for the kidney disease patients, it's really difficult because everything, they have to pay for everything. Nothing is for free. There is no insurance as such. And although the government is supporting a bit, but they still have lifelong burden. And most of the people, they don't have a job, so they don't have income.
Yeah.
And so we started prevention project. So we go to various places, then we screen the people, thinking that if we detect early, we can also prevent more damage.
Yeah.
We have seen like every third or fourth person, they had a high blood pressure. Every time we checked 100 people, there were at least 5 to 10 who didn't know they have diabetes, but they had diabetes. And then we found that the two major background cause for kidney disease is diabetes and hypertension. Then we started looking into that, like how could we deal more with them? And basically in the Western medicine for diabetes, hypertension, we only have the symptomatic treatment. And it was very frustrating that although we have detected that kidney disease early and we could do something, but we still couldn't save those kidneys. Because those who had the kidney disease, autoimmune kidney disease, even though we were treating, they still developed end stage. And that's really frustrating.
Yeah. What would y'all do for the early prevention? I know that you have this nonprofit organization now. What do y'all do with these people who are facing these severe financial burdens?
It's difficult, but the one thing that is the most helpful for them is the infrastructure. If we have a good dialysis unit where they can come and get the treatment done, or if they just get the good counseling, good care, that all makes a difference. So we are running that. We have the clinic, we give support to them, we have them to have a better quality of life. But especially I see that we could do much more if we have more funds.
Yeah, that's hard. I know that you do have this online course, and I'm curious, what are the benefits of taking an online course versus getting a one-on-one consultation with a functional medicine doctor?
Both have the advantage. So if you take a one-on-one consultation and you take a course, then it's combined. It's a combined benefit. But basically, I run the online courses for Hungarian people in Europe, and that's my home country.
Yeah.
And in Hungary, there are very, very few functional medicine doctors, so maybe two or three. those I know. And people, if they want to see a functional medicine doctor, then they just can't. Or maybe there is one or two who are a little bit doing functional medicine, but they have enormous waiting list.
Yeah.
So, and because I'm not in Hungary, so I also cannot be there personally to see everybody. But I was considering that I want to help more people. Then the group program is the good way. And even in a one-on-one consultation, I will not have 30 hours to talk to one person and explain
Right.
everything. But if I make the video course and make it very nicely organized, understandable, then I can talk to them 30 hours.
Yeah.
I can understand everything. So I design my courses in a very basic language so that they understand everything. There's no foreign words in it. And it just takes them through and they get the vision why the diseases come, what they need to do to what kind of lifestyle changes they need to do. And if we are on a one-on-one consultation, I can give you the list. Do this. But
Right.
how would I explain you the why? Because once you understand the why, then you will do efforts and you will do it.
You've got to understand the why behind it, though. I mean, it
Make
just,
a video and explain that, oh, this is how it goes in your body. Then they will just see it and you don't even need to convince them. They will just do themselves.
yeah, that's interesting. As far as what got you into functional medicine, we were talking previously, and you were talking about how IgA nephropathy is very common in Asia and Nepal, but it's not as common in Europe. And I'm also wondering why. But during your questioning of wondering why, you did discover a paper that led you to functional medicine. I'm curious, like, what you determined with that, and if you were able to use a functional approach on anybody with these kidney issues, and what the outcome was.
So it was like 8 or 9 years ago. I was searching some answers, what could be behind IgA nephropathy. And then I found a paper about talking about elimination diet and functional medicine and IgA nephropathy. And it was saying that in IgA nephropathy, gluten sensitivity and milk sensitivity it might be a problem. And at that time, it was not so well known. Like now, everybody's going on gluten-free diet, but that time it was not so much everywhere in the media, at least not in this part of the world. And
Yeah.
so I tried it on my patients. So there was a patient with protein in the urine. It's called nephrotic syndrome. So I had a patient with nephrotic syndrome, and she tried all kinds of medicines, whatever is on the market. She tried everything and nothing helped. And then I told her, just stop eating gluten and milk. And after 1 month, she came and her reports were so good like never before. So I tried elimination diet on most of my patients. And I have seen some good results, but not everybody showed a good result. Obviously, once we know functional medicine, we understand that this is only a small part of the picture.
Right. Right.
That already gave me a good impression that there is something here. And I was reading books, and meantime, I was busy here. We were opening a new hospital. Then the COVID came, we became busy. And I was thinking on studying functional medicine, but I just didn't get there. I didn't have the time and the funds and everything. And after I started my courses, because I just based on my readings in Hungary, many people were asking me, please teach us these things. And I was just, I'll read this book, but yeah, but this book it's in English. We don't know English. And then I sometimes I gave small lectures to my friends, but I found that it was also not enough. You
Yeah.
just give lecture, it is not enough to make the lifestyle changes. And then I thought I will make a 30 days program, practical. Every day there will be some practical thing they have to do. And then gradually they will learn. And this 30-day program, it became a really good success. People were changing their whole life. Their whole life changed after the 30 days program because it gave them a good basis for how to change the things. And once I started doing those courses, then I was able to start the learning more functional medicine.
Yeah.
Uh, and in Nepal, we have just opened our first functional medicine clinic, the first functional medicine clinic in the whole Nepal. We have just opened.
That's
And
awesome.
we have the issue problem like testing, that the most of the tests, functional medicine tests, are not available here. And most of the supplements are not available. So we are just organizing the logistics.
That's like such a big start though, to just have the clinic at least and have a place where people can come in person too, where it seems like a lot of people are interested in craving more natural approach. That's awesome.
I think it's also from the media, social media. There's so many people
Yeah.
talking. 5 years ago, nobody was talking about this, but now even in Nepal, people hear it. And obviously, everybody has some kind, especially in Nepal, people don't like to take medicine. So that's a very big problem, especially for hypertension. People are
Yeah.
afraid from the medication for the blood pressure. So if there is any option that, okay, with the diet, we can avoid medicines, they are very open to that. When we see patients in Nepal, their first question is always, what can I eat and what should I eat and what I shouldn't eat? Every patient will ask at every meeting visit.
That's awesome. Most people
And
here are like, what pill can I take? And you don't always need a pill. Sometimes you do. Like you were saying, if your blood pressure is super high, we need a pill to manage that while we're learning to eat better and get it down, right? But you don't always just need a pill. It's a combination of things for sure. But that's awesome that everybody there is like really eager, not just jump to take a pill and wants to actually do the lifestyle changes.
culture. In the culture, they know which vegetable is good for which disease or which herb is good for which disease. So they already know a lot of things from the culture, what they learned from their parents. They know this vegetable is good for blood pressure. So if you have high blood pressure, you should eat this. Like, they teach each other. So they want to make it more fine. Like the doctor will
Right.
say more. And they usually imagine this, not the lifestyle change, the diet change. They imagine like there are these 3, 4 things I shouldn't eat, and there is 3, 4 things I should eat. And because we have approximately 10 minutes for one patient, and you also cannot give them a big lecture. So we learned how to say in one sentence, like, eat this and don't eat this.
Yeah, for sure. Where can we go to learn more about you and about the Jeewasha Foundation that you run?
Jeewasha Foundation, we have a website. It's called jeewasha.org.
Okay. I'll be sure to link that in the show notes too.
Most of my courses are in Hungarian, but I'm starting up with English language course.
Okay.
Yes, all my friends are asking. Those who are not Hungarian friends, they all are asking to start.
Yeah.
And because in Hungary, I have one course for insulin resistance,
Mhm.
one for gut issues, and one course for thyroid. But I found in English language, thyroid courses are very scarce. There's not so many.
Yeah. That's really exciting. Dr. Paudel, this has been such an interesting conversation. It's always just great to talk to people who do something similar, but especially in different countries, it just opens my eyes. I'm not just in my own little bubble. People all over the world are dealing with similar things. And it's awesome that you're there and your husband's there and trying to reach out to people with a functional medicine approach too. I love that. Is there anything else that you want to leave our listeners with today?
I would like to encourage every listener that they just believe in your body, that your body is a really wonderful, it's wonderfully designed, and it's able to heal, it's able to regenerate. You just need to find those things that are blocking it, and if once we remove the blocks, then the body can heal and the body can regenerate. And just never give up, just believe in it.
Yes, I love that. Thank you so much for being here today.
Thank you for having me.
The Jeewasha Foundation was created to help people with kidney problems get the care that they need. Many kidney patients suffer for a long time before getting the right help, if they even ever do. The goal that Dr. Paudel and her husband had whenever they created the Jeewasha Foundation was to build a center where all kinds of kidney disease can be treated with high quality care that everyone can afford, even the poorest people in Nepal. And they really want to make sure that anyone who needs help can get the treatment, no matter how much money they have. The Jeewasha Foundation is such an amazing thing that they have created. They have organized a large number of awareness and prevention programs in their community. All of this includes screening tests and case findings among high-risk populations. They have been able to discover and help avoid kidney failure for so many people in Nepal by managing their conditions. The Jeewasha Foundation also helps the needy kidney disease patients to get adequate care despite their financial difficulties. So they're able to arrange treatment, liaisoning with appropriate authorities and government agencies, paying for medications and treatments as needed. Learn more about the Jeewasha Foundation at jeewasha.org or click the link in the show notes. That's a wrap on today's episode of What the Gut. I'm so grateful that you're here, and I hope you're walking away with insights that bring you closer to feeling your absolute best. If you loved this episode, it would mean the world to me if you would take a moment to leave a review. It helps more people like you find this podcast and get the answers that they need. And don't forget to hit that subscribe so that you never miss a new episode. Let's keep the conversation going over on Instagram. Find me at Allison Gets Well for daily gut health tips, behind the scenes, and more ways to support your wellness journey. I would also love to hear what topics you want covered in future episodes. If you have a burning question or a guest that you'd love to hear from, shoot me an email at hello@allisongetswell.com. If you're ready for real personalized support on your health journey, check out my one-on-one coaching program at allisongetswell.com. Let's get you feeling amazing from the inside out. Until next time, stay curious, nourish your body, and take care of your gut. Catch you soon. Hey friend, let's talk about something real: bloating, stomach pain, and fatigue. You do not have to live like this. I know because I was there too. I was frustrated, exhausted, and trying everything, but still felt miserable. And that's exactly why I created my Get Well one-on-one gut health coaching program, to help women like you finally get to the root cause of your symptoms, heal your gut, and feel like yourself again. No more guessing, no more Band-Aid fixes, just real, sustainable solutions tailored to your body. So if you're ready to ditch the bloating, boost your energy, and actually enjoy food without discomfort, let's do this together. Head to AllisonGetsWell.com or reach out to me on Instagram at AllisonGetsWell to learn more and apply today, because you deserve to feel good in your body every single day.